We are the world's largest humanitarian agency fighting hunger worldwide. This is something a lot of people do not know. I've run into this in the 3 years that I've been working for the World Food Program, funded entirely by donations from governments, companies, private individuals. Meaning we don't get UN dues. Those donations are voluntarily. Most of the funding comes from the top countries, top economies in the world. The US is by far and away the largest contributor. And in fact, contributions from the US have risen over the past 3 years. That may surprise some folks given the perception of who's in the Oval Office, but actually have risen. We hit $3 billion last year from the United States, up from about a little less than 2 in 2016. So, and overall we spend about $8 billion. Last year we spent about $8 billion. The needs, unfortunately, are probably more like in the $12 billion range. So we're never going to quite get to the gap, fill that entire gap, but it has gone up over the last couple of years. And unfortunately, it's gone up in large part because there's greater need. It's kind of sad, but true that the world just needs us a little more than it did a few years ago. We have a global presence. Our headquarters are in Rome. I spent 2 of my 3 years there in Roma. I'm kind of glad I'm not in Rome, Italy right now, although I'd probably do this presentation exactly the same way from my home office, from one of my spare bedrooms. 16,000 people worldwide. Most of the people who work for the World Food Program are actually out in the localities. They're mostly nationals. So, for example, you might have Democratic Republic of Congo, a lot of people who are Congolese working for us in various parts of that country. They're not necessarily internationals. 83 country offices. The graphic here shows just the colors are only differentiated by our regional bureaus. We also have people in world capitals, including in Washington, D.C., which is where I'm now. We have a London, a Berlin, and brand new Ottawa office as well. So obviously to work with our donor legislators and our donor governors, donor presidents, and prime ministers, and foreign ministers, and that sort of thing. I will say that one of the things that the executive director of the World Food Program, David Beasley, says about the environment in Washington is that Republicans, Democrats, House, Senate, they fight like cats and dogs over everything. But generally, there's really bipartisan agreement in the United States, in Washington, that what the World Food Program does contributes vastly to not just helping us get to a place where we have a lot less hunger, but also peace and stability around the world. Unfortunately, hunger is on the rise. There are 821 million people in the world now chronically undernourished, 1 in 9, and it's 1 in 5 in Africa. It's up from 811 the previous year, and it's the saddest part is it's on the rise after decades of progress. In 2005, there were approximately 950 million people worldwide who were undernourished. It dropped to 2016 to 785 million. So almost a 200 million person drop in the number of people who are hungry. And you have to couple that with the fact that obviously population went up over that decade. But in the last 3 years, we've gone up. Why is that? This picture, by the way, is from Idlib, Syria. Taken overhead in a recent mission the executive director took into northern Syria. And so this is brand new. This isn't some historical picture. One of our bigger operations there is in Syria. And you just look at that and you think, how do people recover? How do people just exist in an environment like that? Now, obviously, this is in the entire Syrian the situation in the entire Syria, but obviously this is a huge, huge problem. So conflict is a major driver, Syria and Yemen being the biggest ones right now, but we've also got conflicts going on, for example, in the, like I said, the Democratic Republic of Congo. We have the Myanmar Rohingya refugees conflict situation driving them to Cox's Bazar. 900,000 people now are in Cox's Bazar, Bangladesh. in a refugee camp just across the border from Myanmar, or what some people might know as Burma, as and we're feeding those people. 75% of the world's stunted children live in a conflict zone. About 80% of our operational costs are conflict related. 10 out of 13 of the top food crises in the world are conflict driven. So it's just a huge problem. Here's your other driver, climate change. This is a picture from the locust swarm in Eastern Africa. I forget which country this is, but we've got the worst locust problem, a desert locust problem in 25 years. 13 million people in this region were already hungry, already food insecure. Places like Eritrea, Ethiopia, Kenya, Somalia, all with huge problems. And then cyclones and hurricanes, which have increased in recent years. And so, for example, we just had I wanted to say celebrate, but you don't really celebrate the anniversary of a hurricane. So the cyclone Idai in Mozambique, which now has the highest rate of chronic malnutrition in the world for children under 5, 43%. So these are the key drivers of hunger. So how do we tackle that? Well, it's a big problem. First of all, we have a mission. We have a motto at WFP: saving lives, changing lives. WFP is the program that's designed to help people in life-saving emergencies. So those climate and conflict situations. Airdrops, you don't see them as much anymore. This is probably over South Sudan. It's the one place where we really have to do airdrops because the ability to access the people in South Sudan is so limited because of conflict and also lack of infrastructure. And what we're trying to do here is, of course, keep people alive and bridge from just making sure they can stay alive in this immediate crisis situation to get to a point where they can slowly recover. And that's what we're trying to do in Mozambique with Cyclone Idai. We focus these food distributions where food's not available in local markets. So we work with a lot of NGO partners. You can go down the list, and we get nutritious food to people, the flour, rice, cooking oil, salt, and some specialized nutritional products that are formalized for specific needs that people might have, pregnant and lactating women, malnourished children. I'm not an expert in all the individual elements of those nutrition, but we do food distribution. But one of the interesting things that has happened and grown a lot over the last couple of years is our food assistance with cash, what we call cash-based transfers. So what we don't want to do, the old days, I think most people had this impression of food being, international food aid being, dumping a lot of commodities into a place that didn't have any, so people could eat. And it's hard to argue that that's a bad thing in and of itself, because it's not. But what has happened is, as we've learned over the years, is that we've learned that that didn't necessarily help the long-term recovery of a particular region. What we want to do, of course, is help an economy out. So we've done cash-based transfers, which empowers people and the economy. They can spend the money where they want to, meeting their own needs. It empowers them. It's not just big benevolent, country, international organization coming in and helping. They can figure that out on their own. $2.13 billion in 2019. That's up about $1 billion over the previous 2 years. So this is, and one of the things we're discovering, just as an aside, is that in many of the places that we're doing these cash, women are becoming much more empowered. They're having access to help buy food and have power in the households that they didn't used to have. And so that's been a good byproduct. Malnutrition being a huge problem, and where we want to particularly focus is on young children, adolescents, and especially young girls, getting them into schools. And that's our other part of our motto is changing lives. And what we want to do, what we're trying to do, and this is part of kind of the message that we're trying to convey here to a broad cross section of the American public and the worldwide public. I think a lot of people that, just don't pay attention to this at all, very often, think, well, what are you doing to make sure that this situation doesn't keep happening? We've been spending a lot of money over the last 50 years, and is it getting anywhere? Is this really worth it? And what we want to demonstrate is that, yes, it is, because what we're trying to do is empower people so they can be more self-sufficient. My boss likes to say the work is really to try and put ourselves out of business, to support our local governments, regional governments, and national governments, so they can help their own people and that people can help themselves. Resilience is what we want to focus on. So we'll do things like not just food and cash assistance, but there might be literacy programs, maternal and child care programs, pre and postnatal health, helping kids get into school and stay there. There might be some assistance working with FAO, the Food and Agriculture Organization, on food systems. So there's better ability to grow those crops and help people help themselves. And in a lot of these instances where we might be digging irrigation wells, building dams, and we essentially trade work on that for the assistance that we give. And one of the big problems that is prevalent in a lot of these places, and it to some extent, it's a little bit of a mirror of what's happening in the Mississippi Delta and in Appalachia, is, the whole food system, people being able to get their food due somewhere is broken. And in the US, we have a lot of waste of food at the table, or as it gets to market, or just after. Around the world, that food is wasted before it ever gets to market. There's, conflict, climate change, instability. So even if you are a farmer, you have no ability to grow more than your own subsistence and get it to market and sell it. So a lot of people don't know how much work we do to, help rebuild ports, to help launch private retailers in Yemen, where there's a huge conflict. We actually have small markets that people can use their cash-based assistance and go and buy food. The Yemen economy is an absolute disaster area right now. And so what we're trying to do is help rebuild it. And we'll do it that way. Our nutrition is a huge focus, in part because that stunting figure that I mentioned earlier, if those first 1,000 days of a child's life, from conception to 2, essentially, if they don't get off well, they're behind. They're going to be forever behind. And what does that mean? Well, that's bad for them, but it's also especially bad for the region, the community, the economy, because that means people aren't ready to learn once they get to school. And then they can't absorb what they need to absorb to be able to get out into the workforce. So we've got to start them early and often. So that's why we do so much with school meals. I think this figure actually is a little low now. I think it's even gone up since 2017. I don't have most recent numbers. But the school meals are a huge asset because they do a couple of things. One is obviously they help make sure kids get food. The second thing is they keep kids in school. Parents send them there and they'll keep them there because they know they're assured of a meal. And the third thing that they do is they keep girls in school. In a lot of the places where we work, girls are, not discouraged to go to school, or they're pulled out, or what have you, early on. And so this gives a much better chance for an even playing field for a longer period of time. And if they stay in school, they're less likely to marry early. Childhood marriage is obviously a huge problem. And they're much more likely to be successful long term. The data is still not quite showing up yet on all this, but it's our firm belief that this has a long tail effect. And the hard part is showing that long tail is really working. That first 1,000 days, like I talked about, we also have to work with the moms. So the mother and child nutrition, to make sure that that they can continue to feed and be healthy themselves, as well as their children. We work with a lot of partners, UNICEF, other NGOs, to make sure that this works. I'm whisking through this because I know I don't have a ton of time, and it's I want to make sure that the smart guy Jace behind me can really dig you into deeper for those of you who are really familiar with what we do. Again, building resilience, a part of that climate change. We want to make sure people have the idea behind this, not just climate change, but also conflict, is that the stronger a community is, its economy, its businesses, its stores, its farms, the more likely it can recover from the shocks that might come. Now, I will say that right now, one of our biggest worries is that, with these supply chains and other things that have been broken because of coronavirus, that the communities and the countries that are not resilient are going to be put further and further behind. It's a deep concern that we're going to have Western governments who are going to be rightly concerned about their own economy's recovery. A lot of pressure internally, domestically, to spend money to stimulate their own local economies. All these countries are essentially the lifeblood of WFP's finances. So it is a deep concern to us that what's happening. And some of it we can't do a lot about in terms of that political pressure, but that's also why we need to continue to be advocates for the good this does for the world. It's plenty and fine to be for it just out of the goodness of your heart, and that's great, and we should. But also there's a reason why it works, and there's a reason why it's better for the stability of the world, which means less migration, which means less violent extremism. And we have to keep talking about that because it's important we have support from a broad cross-section of people. I mean, some of those folks in those counties in Kentucky and West Virginia are voting a little differently than they are down in the Mississippi Delta, and we need both sides to be for that. So anyway, smallholder farmers, most of the world is fed by smallholder farmers. What we're trying to do is get those smallholder farmers markets, work together, get their food to market, and get policies that help out. And women actually benefit from this probably as much or more. The first field trip I took, I was surprised at how many the grand percentage of women. The grand percentage of people are working out there and trying to get food to the market were women, not men. Farm to Market Alliance. I don't want to read slides here. I'm happy to upload this afterwards. Is a big consortium of organizations that we've put together with the help of a lot of other groups to be able to scale up and have a broad market for actual food, so farmers can not just grow their own, but make some money at it, just like we do everywhere else. Real quickly on Sustainable Development Goals, that's our key mission. There's 17 of them, and our keys are 2 and 17: zero hunger by 2030, and then partnership, because we're not going to be able to get to these goals without working with governments, the private sector, and individuals. And moving to individuals, where you might come in, other folks, including for your advocacy. And my slides aren't moving. Oh, well, that's weird.
Sorry.
Yeah, we have a number of different ways that people can come in. We have free rice, which is an interesting game. We have a share the meal. You can look for the Share the Meal app, where you can actually donate a little bit of money as you have a meal. So those are 2 ways that people can come in addition to the organization that Chase is a leader in, WPUSA, which takes individual donations and helps support us.
This is I think a unique situation here in that I don't often get to be in the same spot as Gary. And so I gotta say, we usually have a divide and conquer model. In essence, my job is to support Gary as Gary supports the mission of the World Food Program here in the United States. So I am the Senior Director of the Public Policy and Research at the World Food Program USA. We are, as Gary mentioned, a nonprofit partner of the World Food Program in the United States. We exist for a couple different reasons. One is to take individual donations from individuals, foundations, and private sector organizations, funnel that money from the United States and those entities towards the World Food Program. And then the other half of what we do, which is more of my purview in my space, is public policy in the United States. So as Gary mentioned, we rely on voluntary funds at the World Food Program, and the United States is the single largest contributor to WFP and other humanitarian organizations around the world. And so to an extent, it's also our job at WFP USA to continue to help to keep those dollars flowing year in and year out. We have a lot of congressional affairs experts in our shop that help us to be able to do that alongside folks like Gary and others. If you look at the agenda, you would have seen me talking about climate change and food security. I want to audible just a little bit because I think we're at a really important moment right now with the COVID crisis, and we're in the early stages of identifying how this virus might impact global food security concerns. So bear with me in this because let's take a moment while global emissions are lower than they normally are to pivot away from climate for just a moment, keeping that in the back of our mind. There is nothing more critical than that topic. I mean, as Gary mentioned, a lot of the increase in hunger that we're experiencing in recent years is a byproduct of increases in climate-related extreme events and man-made conflict. And those things both live together in kind of a vicious circle. So let me jump right in and focus on this COVID-19 crisis. This is really important to an organization like the World Food Program, and great that Gary was able to outline the broad strokes of what we do. I think you got a good sense of World Food Program. I've heard the organization referred to as the most important organization that you've never heard of. And so part of our mission is getting out and having conversations like this. But what really interests the World Food Program in something like COVID-19 is that the majority of the populations around the planet that are going to be disproportionately impacted in terms of their vulnerability by a virus like this are places like Sub-Saharan Africa, it's places like South Asia. These are places where there's limited healthcare infrastructure, and you have already vulnerable populations. It's also the places where we have the highest concentrations of hunger and malnourishment. So that in and of itself is important to the World Food Program. The second that Gary touched on briefly with our logistics capacity at the World Food Program, WFP is the premier logistics partner in the United Nations system. And so when the World Health Organization needs to move beds, tents, medicines, vaccine, in addition to the foods that the World Food Program is moving, WFP spends a lot of time helping out humanitarian partners in moving that core base logistic products from place to place. And so we've got, if you look at the portfolio of the World Food Program, and this is a place with a huge presence on the ground, 17,000 staff, 5,000 trucks, 90 aircraft, and about 20 ships in the high seas. And so that footprint is really important in a crisis like COVID. I'm going to try to advance my slide here if I can. Gary already mentioned the broader trends in global hunger, and I don't want to reiterate that. Suffice to say that after years of progress, decades of progress, really the last 3 years, we've seen an increase in both chronic and acute hunger. Acute hunger is the trend that is most germane to what the World Food Program does. The numbers of acute hungry people have risen above 100 million people. Those are folks that are in need of life-saving food assistance. These, for lack of a better word, are WFP's constituents and people that the organization is serving first and foremost. As Gary mentioned, the funding needs have also gone up for the organization. And what used to be a $4 billion global organization is now upwards of 10, closing in on $12 billion organization. So these needs have risen in tandem with the rise and increase in global food security. So I mention all of this just to say that this is a really difficult time in the fight against hunger at a global level. And the fact that we have COVID-19 layering in on top of this is only going to complicate measures, and it's going to frustrate the ability for humanitarian organizations like WFP to meet that 2030 SDG Zero Hunger goal. So that's the context and background for this conversation today. We've heard from very early on from folks like Schengen Fan, the former Director General of the International Food Policy Research Institute in Washington, D.C., that COVID is a health crisis, but it can also lead to a food security crisis if proper measures are not taken. And this is exactly right. If you look at the history of previous outbreaks, that we've had just in contemporary times, whether it was Ebola, SARS, MERS, all of these viruses and all of these outbreaks had very similar effects on the agricultural economy and global food security. Right, first and foremost, in the places where these viruses hit, we had reduced agricultural production. And this meant that sick people weren't tending to their fields, they weren't working in agro-processing centers. All of this limited agricultural production in countries that were affected. We've also seen, in previous instances, limited agricultural trade. We're especially seeing this in places like around COVID because of the emphasis on closing borders that we've seen. Now, to date, we haven't had major disruptions in global food supplies, and we're going to talk about that going forward. We've really limited the ability for humans to cross borders, but we have not yet limited the ability of supplies and goods, raw materials and staple foods to move across borders. And so that's an important, I think, distinction in this crisis. Anyway, Ebola, SARS, MERS also saw an increase in unemployment, decreased economic performance. We saw food price spikes in all of the countries, especially affected by Ebola, first in 2014 and 15, and then later in 2018 and 19. Importantly, we've also seen higher prevalence of hunger. So these viruses have a history of increasing global hunger. They have an increase in increasing, they have a history of increasing hunger in local communities as well. So just one case study really quickly to go back to 2014, and this is all data from the World Food Programme's Vulnerability and Analysis Mapping Group. When we saw the outbreak of Ebola in 2014, we could really map the trends in associated hunger with the increase in Ebola instances. And so if you look at the map on the left side here from October of 2014, the darker red, much like our map from Kentucky, represents countries and places or counties within these countries with the highest levels of food insecurity. We saw quickly over a 6-month period how those number of counties increased pretty severely in both number and intensity of food insecurity. So we know that these viruses go hand in hand with the rise in hunger, and so this is why this is so important to the work that the World Food Programme is doing. I want to tell you 5 quick things about COVID virus, 5 evidence points here that we can talk about now. And I want to mention at the outset of this is, I'm not an epidemiologist. I am not an infectious disease specialist. I work in global food security. What you're seeing here is going to be reflective of what we've seen in past instances of outbreaks in the past. So first and foremost, COVID-19 poses a great threat to nations suffering from pervasive poverty and poor healthcare infrastructure. So you look back for early days of the coronavirus outbreak, and you had the WHO Director General saying, our greatest concern is the potential for the virus to spread to countries with weaker health systems. And we're seeing this happen today. Today, we're looking at about 30 plus countries. I looked this morning, it's about 32 countries that have confirmed cases of COVID-19. These are precisely the sorts of places with limited healthcare infrastructure. Bottom line is that these countries also have very limited ability to test and trace disease presence. So while we have it in 30 countries now, very likely that prevalence of the disease is much higher than we actually think it is. Also, backtrack to early February, and there were only 2 countries on the entire continent of 54 countries that were able to test for the virus. We've since scaled that up with WHO to a number that's closer to 40 or 45 now. So the testing has improved, but it still remains a pretty major problem. These places, of course, also tend to be home to the highest levels of undernourishment. And Gary mentioned, while globally about 1 in every 9 people are affected by chronic undernourishment, on the sub-Saharan African continent, it is closer to 1 in 5 or 22% of the population. So this is a really, COVID is going to affect places with pervasive poverty. It's going to affect places with limited healthcare infrastructure, and those places also have the highest levels of global food insecurity. One last point here on this topic is that we are experiencing now, as you look around the world, some of the highest rates of displacement from violence, conflict, and persecution that we have seen really since the Second World War. So there are about 75 million people who have been forced from their homes because of these factors, and about 25 million of them have crossed their borders. A lot of those folks who've crossed their border and have become refugees are living in cities, But there is a large number of them that are living in camps, especially in developing countries. And these are prime constituents and people and beneficiaries of the World Food Program. We're starting to see some reports of the vulnerability of such camps to COVID-19. These are places where people are living in close proximity with one another and where they have limited healthcare infrastructure. So that's point number one. Point number two is COVID-19 poses a severe threat to places lacking social safety nets. School meals is a big part of what the World Food Program does. You saw from Gary's slides in his presentation that we provide school meals to many millions of kids in 50 or 60 different countries around the world. And the World Food Program is the single largest provider, non-government provider of school meals. But what we're seeing today is that about half of all the world student population is out of school right now because of COVID-19 measures. And that means that there's at least 300 million kids who would have otherwise been receiving school meals that aren't. Now, the legislation that just passed yesterday in the Senate and expected to be signed by the president hasn't yet. That bill provides in the United States support for families and parents who have kids at home who are no longer receiving school meals. In so many places around the world, those safety net systems can't be scaled up because they either don't exist or there's limited capacity to do so. So around the world, about 20% or 1 in 5 people living in really low income places have access to any sort of safety net system. So the measures that we have working in the United States, I think are unique in that sense, and we can scale those things up. That's not always going to be an option in places where the World Food Program is working. This morning, I saw that we've got, specifically the organization has been affected, school meals have been affected in about 30 different countries, and it means that about 9 million children that were involved in WFP school meals are no longer receiving them there. There's contingency plans in place to try to send take-home rations home with those kids and other measures to try to make sure that parents are protected. But the government is unable to provide those things in many cases. 3, let's talk about the way that COVID-19 can prove especially deadly for people suffering from malnourishment, right? At its core, proper nutrition is the bedrock of good health. And we've seen this in countless occasions. We know that children who, in particular children who are undernourished, are 9 times more likely to die from infectious diseases than children who are healthy. Right? And so we've got to be protecting our populations. We've seen this over and over again, this link. And we've talked, Gary and I both have talked about 2 types of food insecurity around the planet. We've talked about undernourishment, that 1 in 9 figure, and we've talked about that 100 million plus people in need of food assistance who are acutely hungry. But there's all sorts of food insecurity that exists in the world, including people who are moderately food insecure, people who are micronutrient deficient. We call that hidden hunger very often. And then we have people who are stunted, wasted, children in particular, who are stunted and wasted, and obesity problems. So the malnourishment problem is a sizable one and makes these populations especially vulnerable to the impacts of COVID-19. Now, a couple of really quick case studies. We also see this relationship between disease, let's say immunodeficiency, and hunger and death from disease in cases where people are suffering from HIV and Ebola. And what happens in HIV is typically the virus prevents absorption of nutrition in a way that it doesn't in a healthy body. And also people who are suffering from HIV are really burning more energy, between 10 and 30% more energy in a given day, and just fighting off that disease than the average healthy person. And so those people have very unique nutritional needs. Antiretroviral medicines also require a certain baseline nutritional status to be effective. What we've seen on the Ebola side of things is that survivability from Ebola and the Ebola virus was really determined by what researchers are calling preceding nutritional status. And essentially that means is that healthy people who were affected by the virus, people who were nutritionally sound and who had good baseline nutritional health, were more likely to survive the Ebola, the infection of Ebola than those that didn't. And so we're seeing this over and over again. Again, proper nutrition is the bedrock of good health, and we have to keep reiterating that over and over again. So 4th point here is that COVID-19 may produce supply chains breaks, food shortages, and price spikes. Now, we see this, of course, in the United States. I mean, if you go to the grocery store, all of us are going to have this experience. Some of this is just simply on the demand side now, more people going, panic buying, hoarding behavior. This, of course, is affecting our markets domestically. But there are bigger concerns internationally. Right? We live in this very globalized food system. We produce 4 billion tons of food a year collectively as a population. All of that food needs to be moved around to markets where it needs to be and closer to consumers. We have a global food supply chain today that delivers exactly the right amount of product at exactly the right time. Disruptions in that have meant that people aren't getting food in the way that they would have otherwise. And it means that people are not stockpiling food in the way that they would have in the past. Supply chains have just grown more efficient, but also more vulnerable to those shocks. Trade has also increased pretty tremendously. Talked about that 4 billion tons of food around the planet. Agricultural exports have increased by over 800% in the last 25 or 30 years. The value of ag exports now are about $1.5 trillion. So it's a huge amount of food that we're moving around from place to place. And if you look at specific commodities, I mean, soybeans, for example, about just a little under half of every soybean grown in one place in the world ends up in a different country. 25% of wheat grown, 14% of corn, 10% of rice. So we're growing, we have really concentrated growing areas around the world, and we're trying to move that product from place to place to meet demand and to meet markets. We know that from the 2007 and 2008 price crisis, that there were certain things that caused global food prices to rise pretty dramatically. One was export restrictions in countries where countries were trying to protect their markets and to protect their stores of food and the quantity of foods on shelves. Market speculation, panic behavior, all of these sorts of activities only further compounded the issue of food price spikes in that time period. We are not protected against any of these measures today. We could see some of these things happen again today. We're already like I said, we're already starting to see certain export restrictions. We're already starting to see the reduced movement of humans across borders. We're going to see downstream impacts on supply chains and the movements of goods eventually. That's likely inevitable. All of this to say that in 2007 and 2008, we experienced food price riots in about 40 different countries. We saw the toppling of at least one government and severe instability in another. I was reading the other day that the average American, at least, has about 3 days of fresh food available in their homes. This does not count the more non-perishable things. And so the author mentioned that we are probably, you could say that we are 9 meals away from anarchy, even in the United States. And so you can imagine what the situation is like in places with more tenuous supply chains and markets. Finally, last point here, and then I'll stop talking and we can have some Q&A on this. But COVID-19 may cause global economy to slow, exacerbating extreme poverty and hunger. We know this is already starting to happen. The OECD just released their latest statistics, and they have done major revisions to their global growth prospects this year, cutting their estimates for growth from 3% of GDP to 1.5%. We have a history in this space, knowing that really since 2007 and 2008, FAO and other organizations have been really monitoring the impacts of these economic downturns on hunger. And what we've noticed here is what you're looking at is a graph of the number of places where the prevalence of undernourishment has gone up. So hunger is rising in these places at the same time that the economy has taken a hit in some way. And you can see that this sort of pairing of economic downturn and the rise in hunger is very strong in the 14, 15, 16, and 17 years. We expect this trend to continue. Poverty, hunger, and economic decline generally are pretty good friends and travel together. So we can expect that based on COVID-19. We also know that a huge percentage of the world population is living in a very small budget. In the United States, of course, we spend maybe 10% of our income on food. In places where WFP is working, populations tend to be spending closer to half or 60% of their income on food. 700 million people are living at this World Bank decided 190 a day or less, but more importantly, 50% are living on less than 550. and about 70% of the world population is living on less than $10 a day. So this purchasing power and this question of access, we talked about the three-legged stool of global food security, of availability, access, and utilization. All of these things really matter. It's the access piece that can be very confounding and difficult for people to deal with. Let me end just quickly on a positive note as it relates to COVID and global food security, especially for sub-Saharan Africa. We are looking at a continent that has some of the youngest populations on Earth, the absolute lowest average age on the planet. A lot of places in sub-Saharan Africa are rural still. We have some major cities, of course, along coastlines and major populations in cities like Lagos and Accra and others. But many places, especially where hunger is prevalent, these are still rural areas, they're sparsely populated. It's difficult for disease transmission in those places. One important difference between this disease and others, of course, is the way that that COVID-19 is transmitting. Right now, it's human to human. There are no livestock impacts just yet. The disease is not affected that way. But for communities that do hold large amount of livestock, which is very common for folks, especially in the African Sahel, where there are a lot of herding communities or people who keep agriculture, who keep livestock alongside their agricultural areas. All of these are important for the chain of transmission. We also know right now that if you look at global food stocks, we are sitting on about 3 or 4 months of global food stocks right now. Generally speaking, we produce about 26, really it's like 2.5 billion tons of food, cereals in a given year. We usually consume about that much, and there's also a certain amount of consistent carryover. That carryover, 800 million metric tons, should keep us going for 3 to 4 months. Obviously, we have redistribution issues there as well. So let me just leave it there. As Gary mentioned, you can learn more about what the World Food Program does and about World Food Program USA by visiting us at our website, wfpusa.org. You're going to find links there to the free rice tool I was mentioning. You're going to find links there to the Share the Meal tool. And you can also follow us across our social media channels here as well. So let me leave it at that and see if there's any questions.